Okay, so we have a lecture today. How you guys doing? Good. And the topic of the lecture should be something very important to everybody, right? So the topic is diabetes mellitus and cholesterol, two chronic disorders. How many people have somebody in their family with diabetes? Okay, you see a large majority of the hands go up, right? How many people may have hypercholesterolemia? We don't know, right? But if they ever have a heart attack, then we know that could be a cause, right? So I was talking to a couple of the your colleagues earlier, and I believe I even mentioned the last time I was here. I can remember, years ago when I was at downstate, there was a research, and they tried to get a specific diagnosis called flatbush diabetes because it was so prevalent in this particular area. But what happened was diabetes is diabetes no matter where it's at, whether it's here or whether it's in China. So that research went, but it really didn't get that diagnosis recognized. But it was interesting to me at that time, and we all aghast when we hear that, but if you walk around the corner and you see the abundance of restaurants available to everybody any time of the day, you get an idea, because we know that diabetes, especially type 2, is a function of weight gain as well, right? And obesity. That shouldn't be a mystery at this point, right? And the sad part about it is that adult onset, which is diabetes type 2, happens to what? Not only adults, but to what? Kids younger and younger and younger, right? And you'll see as young as 2 years old. So the goal of this lecture is to understand basic knowledge of insulin-dependent diabetes mellitus, or which is type 2, or actually type 1, and non-insulin dependent diabetes, which is type 2. So you hear those phrases interchange, but so insulin dependent is type 1, or what they used to call juvenile diabetes, and non-insulin dependent is type 2, which they still refer to as adult onset diabetes, right? And also the role that cholesterol plays in these conditions, right? So this is a dual lecture. We'll be talking about cholesterol and diabetes, and just so happens that there is a connection, although it's not clear, that a lot of time, if anybody knows people who are diabetic, a lot of time doctors put them on a statin or cholesterol lowering drug just because they're diabetic, because the research and history shows that people who suffer from especially type 2 eventually have hypercholesterolemia as well. Okay? So, and also just we'll go over some simple lab values, common lab values, and just examine treatment options. So, again, the meaning of diabetes is called sweet urine. Actually, that's what the Greeks termed it, because obviously that's the only way they found out about it back then. So I'm glad I wasn't a doctor back then, huh? Yeah. Yeah, that's the only way they could determine. They realized people were ill, and well, why? Well, he's sweet, so maybe that has something to do with it. So that's the original definition. And obviously we were talking about diabetes type 1, diabetes type 2. There's something called gestational diabetes. Anybody knows what does that mean? Huh? Exactly. So gestational is when women are pregnant and they have high sugar. They call it gestational. The only thing about that is, what do you think is going to happen to the child in the womb if the mother is a diabetic? That's right. So then that means the child has not only will suffer the same thing, but even if they control it, when they come out, they have a greater risk or a greater chance of coming down with either type 1 or type 2. And another type of diabetes is called diabetes insipidus. Anybody ever heard of that one? Okay, so that's kind of like a lesser known one. That's a little different. That really doesn't have anything to do with sugar, but it has to do with fluid and urine output. So this specific diabetes actually is more like an autoimmune, and it affects in a kind of different way. It has something to do with our ADH, or what we call anti-diuretic hormone. So it has mainly to do with urine and fluid levels. Okay, so you'll see a picture there of what we see when we look into your eye. When you go get your physical and the doctor puts that shiny light in your eye and we look in it and you're like, what is he looking at? You know, is it, what's wrong with my eyes? Well, we're not looking to see your vision, to see if you're 20/20. You know, we're looking to see the back of the eye or the retina, and what we see there are the vessels. The vessels we see actually what we call the AV crossing, or the arteriovenous crossing in the eye, where the arteries and the veins meet and there's a capillary, and we can actually visualize that and see it perfectly clear. And the interesting thing about that is that's the only way we could see inside of you, what we call in vivo, without cutting someone open, right? So I can actually see your veins and your arteries through that process, in vivo. And so that's why I love this little device. Plus it tells us a lot about retinal health, right? We can tell about a lot about general health by looking at the retina, right? Because diabetes, hypertension, things like that, we call those things end organ disease. Well, why do we call them end organ disease? Because most of the damage takes place at what we call end organs. Well, what is an end organ? Usually the end organs are where the capillaries meet. For instance, like your kidney. That's why if a person is diabetic or hypertensive, there's a lot of destruction to the kidneys because of the capillary beds that's there. Same thing with the retina. Okay, so when we look at the retina, it's normally nice and clear and beautiful, you know, red and nice and clear. But if a person is suffering from long-term hypertension, long-term diabetes, we see plaques, and we can clearly see plaques. You can see a lot of things. You can see actually infarcts, meaning mini strokes that happen. Now, over time, obviously, I mean, it can be reversed. You know, you can check 6 months later and you can see it resolved itself, and that's the whole goal of treatment. And that does happen, but at the time, you see the destruction that's being done by these chronic disease, and it's noted that that's a fact. So that's why these disorders may seem common, but they really have to be treated rigorously, and it will really cut the years off our lives if we don't get them in check. So a basic knowledge is if you can get your sugar, if you can get your weight, if you can get your blood pressure down pat, by the time you're in your 40s, you won't have to worry about it down the line in your 50s and your 60s, because it's only going to get worse. So while you're young, people are young, we need to take care of this. And it's a serious game that we're talking about. Now, again, the end organs, that's why, you know, people who have diabetes, a lot of times they end up on what? They end up on, they have kidney damage, they end up being dialysized. That's the main reason. It also affects the eyes. Like I said, a lot of them can go blind down the line. Obviously affects the heart. Okay, not directly, but indirectly because of the cholesterol. Okay, so on the back end, what we call back load or post load, obviously if you have high cholesterol or plaques in your veins, not only is your pressure going to go up, of course, it's going to give extra pressure on the heart, and the heart will enlarge, ultimately leading to what we call heart failure. So you see there's a lot going on. It also affects the nerves. What happens to people with diabetes? Where does it go? Their foot, right? A lot of times they don't have sensitivity in the feet, right? Because it goes to the nerves. What is that term called? Neuropathy, exactly. So a diabetic neuropathy is a result of the disorder. And that can be treated, but if left unchecked, then what's going to happen? You lose a leg or a foot, and then eventually you end up losing the other one, right? So I don't want to scare anybody. Sometimes we need some scare tactics to get it right. But it's just a result of the disorder. Now I can't say I know anybody, but I had a colleague who their dad, diabetic, long term, elderly, end up losing a leg, lose a foot, then a leg, then end up losing another. Now he's in a wheelchair. Okay, so what's gonna happen after that? They get depressed. They don't want to go outside. It's pretty much downhill from there, right? Once you get depressed and you already lost your limbs, then you're like, well, what do I want to live for? So it's a whole plethora of things. It's like a how do we say, a vicious cycle of things that happen. Mm-hmm.
She had diabetes since she was a little girl.
Mm-hmm.
So as she got older, she stopped progressing.
Right.
Progressing very slowly.
Right.
For 14 years,
Mm-hmm.
we were taking care of her.
Mm-hmm.
But she was stuck in toe. And
Mm-hmm.
Dean said that she was adamant.
Mm-hmm.
Don't let them cut me. Don't let them take my leg or my
Well,
take a leg. It's just
exactly.
And that's
Exactly.
She returned to do several shots.
Mm.
So our elders, in
Right,
particular,
right.
our elders,
Mm-hmm.
and
Mm-hmm.
setting their way like, well, I guess I can what advice, but they're setting their ways. And then it's cultural things as well.
Right. But you know what? At the end of the day, it just has to be treated early and it has to be triggered rigorously. If we walking around here and we don't know, how are we going to know? Now, what if I bought my little sugar swabs to take an instant sugar? Oh, my sugar's high. Well, what are you going to do about it? What if I bring the cholesterol sticks and say, here, oh, I didn't know. So we need to use prevention, right? Go to your annuals, right? Go to your yearly physicals, and you have to be aggressive. I mean, it's the sad thing about it is it's easily reversible. If a person changed their diet, it all goes reversible, but not when they are amputated. It has to be when they're young, or you just discover it in your 40s or whatever, maybe early 50s. You all of a sudden say, I'm going to turn a vegetarian, let's just say, you turn your life over. It's reversible. That's the sad part about these disorders. Mm-hmm.
But are they both reversible, one and two? Because one is genetic, right?
Well, there is obviously a genetic aspect of it, but it's more environmental. It's what you put in your mouth, really, in terms of type 2. Type 1 is more like an autoimmune, so that can be more or less genetic.
And that's not reversible, right? You just have to keep an eye on it.
You have to keep an eye on it, exactly. You have to keep an eye on it. Yep. Mm-hmm. So again, effects, and this point here, it affects through the process of glycation every cell in the body. So it's just not the end organs. Every cell is affected. Every cell. The glycation process is a process that speeds up everything. It speeds up aging. It adds extra weight. So that process is continual. So until it's reversed, the process is continuing. So I mean, we actually age more than we should be aging under these processes. So we need anti-aging protocols for this as well, right? So let's talk a little bit about cholesterol, right? We all know about cholesterol. We know the numbers. We know there's a good one. We know there's a bad one. But what is all of that about, right? So we know we got LDL, right? That's the bad one, right? And too much can build up in the arteries. The LDL is the one. Remember, cholesterol is in every cell of the body. We need cholesterol. Another thing is this. 75% of the cholesterol we have is produced in our own body. It's produced by the liver. It's the 25% that comes exogenously, or what we put in our body, that's the problem. Especially if we're eating trans fats and processed and packaged foods, right? So that's the bad one, because that's the one that shuttles the cholesterol around, the LDL. HDL is the good one. That's the one that helps the body get rid of it. And then you got triglycerides, which is another type. And that's a type of fat that's carried through the bodies. And that can be enhanced by especially eating sugary foods, fattening foods, even alcohol, because what? If you eat a lot of sugar and a lot of fat, it gets stored, right? It doesn't get used up. You're not exercising, let's just say it turns into like triglycerides, right? So what's the connection between diabetes and cholesterol? There is a connection. We know diabetes tend to lower the good cholesterol and raise the bad cholesterol, as well as your triglycerides, which increases the risk for what? Heart disease, right? So that's the main reason why when you see your practitioner, if he suspects that you're diabetic, a lot of times he'll say, here, take this statin too, because the statin will do what? Lower the cholesterol, right? Any questions? Don't let me scare anybody. we're all in this together. I think that's the next. I think that's a part of my practice. I thought about it because I do pain management, you know. But I think if I did wellness, I could kind of reach more people, you know. And you know. Hey, you, let me take your blood pressure. Everybody's high. Yeah. What's this?
There is a lot of talk about omega-3.
Right. Mm-hmm.
Does that really help with cholesterol?
Oh yeah, definitely. The omega-3, actually the fish oil is actually a pharmaceutical drug now, and it's prescribed to lower cholesterol. It's just in a high concentration, a high dosage, and yeah, good old-fashioned fish oil has been a pharmaceutical. I forgot the name of it, but for the past year or so, they just got clearance, and you got to get a prescription for the one that will lower your cholesterol. Even the one out of CVS. I mean, you have to take a ton of it, but it will still lower if you knew how to dose it properly.
Actually, I see them in the 99-cent store.
Right. Well, we don't want to get that one. Because think about we don't want to get that one. We want to go to a good pharmacy like EDS or Economy, Drug and Surgical, and get our fish oil from a reputable pharmacist. That's what we want to do. That's the only way. Because the thing about that is, since it's fish, you're looking at contamination now, and a lot of that stuff is mercury, contaminated with mercury. And if it isn't from a pristine source like Nordic European waters, then it's probably going to do more harm than good, right? So diabetes type 1, right? Commonly known as juvenile diabetes, right? Mostly children and young adults, right? The cause is unknown, and it is most likely an autoimmune origin. It is basically an autoimmune. What happens there is for some reason the pancreas doesn't produce the insulin that's needed, right? So that's why it's insulin dependent, right? So what does insulin do? Anybody know? Right. So the cell needs insulin to help force the sugar in. Without that, where does the sugar go? Into the bloodstream. And that's when we get the level and say, oh, the sugar's high. Right? Mm-hmm.
The mother, right, that
Mhm.
has gestated
Mhm.
5 years. When the baby is born,
Mm-hmm.
does the baby have, well, some babies, do they have that one or that two? What do you consider?
It's gonna be usually, if they get it in check, usually the baby hopefully won't be born with it, you know. But down the line, usually they would probably get type 1 juvenile.
Because I never really thought about it because my older sister
Mhm.
always had it.
Mhm.
And all because we don't really have diabetes, but
Right.
all 4 of our kids do.
Mhm.
So I'm like,
Mhm.
now that you're saying it, I'm like,
Right.
that's what it's coming from.
Yeah, definitely. Mhm.
And the kids all 4, and the kids were all born like really big. Like
Mhm.
my niece was 14 pounds.
Yeah, that has a lot to do with it too. The birth weight. High birth weight babies are definitely at risk. Yeah.
Yeah, I was reading somewhere, I don't remember where, sometimes the pregnant is good, and to the side of diabetes, but once the pregnancy is done, and they give birth, and the condition is
Right, right. They usually born okay. Like, I mean, you don't hear of a newborn, born with it. Usually they can, get it under control. But we know for a fact that children as young as 2 years old come down with type 2 nowadays because of a lot of different reasons. So this can be one of them.
And it's a myth, right? To say that someone with diabetes, that makes them, that's a myth.
Yeah, that's a miss. You see them at, obviously it's a risk factor, a couple extra pounds here and there. But, I've seen slim people with it too. Yeah. So. Well, you can't really say they're both bad because, and eventually I'll show you type 2 can turn to type 1 because eventually type 2, see the difference between type 1 and type 2 is this. Type 1 is insulin dependent, so they're not making insulin. Remember, type 2, they're actually making the insulin, but it's not getting into the cell. You can pass that down to the gentleman that just came in. Yeah. So type 2 makes insulin. It just can't, the cell just can't take it in. Now what happens if they keep pushing out insulin, we would like it to be an endless supply, but a lot of times the pancreas gets affected and the pancreas stops putting out. So guess what? They'll have type 2, but eventually they'll become insulin dependent. So they'll be on type 2 and still taking insulin, when insulin is usually reserved for type 1. Right? Okay. So again, does right, exactly. Right. It is. It definitely is. So the symptoms of type 1 are usually, how people really realize it is they're always thirsty, the excessive urination, and down the line is the ketoacidosis, the fruity odor. But that's way down the line, like if the person passed out all of a sudden, or why did he pass out? They're in a diabetic coma. That's down the line. That's if it's left unchecked. That's the ketones. What happens is a process where they stop using, say, sugar as a fuel, and they'll use ketones. Ketones is just a breakdown of it's just an alternative fuel source, and that's where the fruity odor comes from. That's why they call it ketoacidosis, because that's the state they go into before they go into a diabetic shock. Everything. Yeah, their breath. Right. Well, yeah. It's a distinct. Right. It's called exactly fruity odor. Exactly. So no. Yep. So now diabetes type 2. That's the non-insulin dependent reset. It can eventually turn into type 1 because that's characterized as insulin resistant. Although they produce the insulin, they can't get into the cell because they lack the receptor. So they're insulin resistant. And again, you used to be adult onset around age 40. Now it's younger and younger, and as young as 2 years old. And well, that's the sugar, yeah, because the sugar will turn into extra weight. So it's the extra weight that causes it. It's the weight gain, right? So in the U.S., total cost associated with diabetes was $178 billion. I think we're in the wrong business. And again, the symptoms are increased urination, and numbness in the feet or the big toe if it's left unchecked. So labs, right, for diabetes, they look at the hemoglobin A1C. That's over time, over a 3-month period. They want your labs over 6.5, right? Or fasting blood sugar over 125. then they call it that. But between 100 and 125 is what you call pre-diabetic. And a random, in other words, if I just took your blood sugar now, even after you ate, it should still be under 200. So a random blood of over 200, right? That's for diabetes. And for cholesterol, total under 200. Like the total, the good and the bad. And the ugly, for that matter. Under 200. But the LDL, specifically, they're looking for LDL to be under 100. 100 to 130 is good. And HDL over 50. HDL can go as high as it can because HDL is the good cholesterol. So a person who works out regularly and eats right or whatever, they can have an HDL very high, which you can't say, oh, my cholesterol is high. If it's the HDL, it can be as high as they want. And eventually the triglycerides should be under 150, right? Now, treatment.
What's the link between diabetes,
Well, that's just for the fact that both of them are chronic diseases. I don't know if there's a tremendous link because you're talking about an STD and a lifestyle. You know, that would be the link. You know, people, no matter what they suffer from, need to just take care of themselves better and be aware of the choices that they make. So in that case, I would say there's a similarity. So treatment, healthy eating. So happens the treatment for diabetes and treatment for cholesterol is very similar. Healthy eating, right, should consist of nutrient-dense food, low on the glycemic index, preferably whole grain, right? Low on the glycemic index, and you know, good combination of complex carbs and protein. If a person just balanced their food groups, if they just ate a good fat with a good protein and a good carb, that alone would get the glycemic index down and get the weight down and get their numbers down. So the glycemic index is the premise of some of those diets like Nutrisystem. All it is a combination of food. Let's just say an apple in itself is sweet, let's just say somebody can't eat an apple. But if you just took that apple and just say dipped it in, let's just say peanut butter, which is a good oil, monounsaturated oil, then that's a good mix. Right? And that will have now I can remember when I first started, I had a person, they always say, hey, you know, when I take my sugar after I ate a turkey sandwich, it's high, but if I had ice cream the night before, it's not. How can that be? Well, look at ice cream. Ice cream is from milk, right? Milk is a perfect, well, whole food, right? Because milk sustains life. Perfect balance of what? Fat, protein, and carbs. So I can see that happening, right? And that's the reason. And white bread is the worst thing you can do for yourself based on the glycemic index. Yeah, based on the glycemic. But I mean, if you had a white bread and say dipped it in olive oil, hey, you're doing excellent. You know. So as a matter of fact, it's a matter of combinating the foods, and that's the whole key to it.